Let's bring in NBC News medical contributor Dr. Natalie Azar. Dr. Azar, who may have the right to say, I told you so, because I believe that you warned some of this might happen when we had you on the show on Friday. First, let's play a clip from SNL over the weekend where they poked fun at this confusion over the guidance. Take a look.
It's your boy, Fauci, the patron saint of Purell. The CDC announced that people who are vaccinated no longer need to wear masks, outdoors or indoors. Pretty great, right? But a lot of people had questions, such as, what does that mean? What the hell are you talking about? Is this a trap?
Okay, so a lot of people do have questions. A lot of people are unsure when they should be wearing a mask. So tell us now, if we are fully vaccinated, what should we do in public, especially since we don't know if the people around us are vaccinated, and especially since, as we just heard from Vaughn, it varies depending on where you go.
I know, Savannah, I think the real issue here was not really in the science that led to this decision. I mean, they can back that up fine. You know, the vaccine in the real world is effective at preventing infection and transmission. It's effective against the variants. 12 to 15-year-olds are just authorized. But I think what the problem here was really in their communication. They sort of really made kind of like a global, sweeping statement that all vaccinated individuals suddenly have this new liberty. And I think the problem is that, or the concern is that there's an over-interpretation of that, meaning that that is true for every locality in every state in the country. And that is the nuance that I think was missing from the announcement last week that Dr. Walensky and Dr. Fauci kind of needed to, elaborate on and give a little bit more granular detail. For example, I've heard public health experts saying things like, states prior to this announcement were saying we're ready to do that for vaccinated individuals, but not until we have 70% of our population who has received at least one vaccine. And suddenly, with this announcement, that kind of went out the window, and certain states were, implementing this new guidance before they reached that threshold, which is really not necessary. It really, they could have just waited a couple of more weeks.
And what would you encourage businesses to do right now? I mean, how do they keep employees safe if people are coming in and it's really just on this honor system?
Yeah, if I'm a business owner, you have to think not only of your frontline workers, essential workers who will still probably want to be masked to protect themselves, but think about your customers and your patrons as well. There are a lot of individuals out there who, for whatever reason, may not be able to get the vaccine, or perhaps they're immunocompromised, or they're transplant patients who may have gotten vaccinated, but they haven't mounted an adequate immune response. Now, they used to be able to navigate public places feeling relatively comfortable and confident because other people were masked, and they may not be able to do that anymore. So quite frankly, I hope that businesses, feel comfortable that they can make decisions based on what is good for their workers and safe for their customers, and unfortunately, they're not going to have the CDC guidance to back them up on this. And so I do foresee potential conflicts in the next few weeks for those businesses.
Yeah, we do not want to see any more of those types of videos from within stores. Dr. Azar, we all have a lot of questions about this new guidance. I mean, that's kind of, I think, why this SNL sketch is so funny, because it really just does hit with a lot of people. What kind of questions do you have about it? Do you think there's anything the CDC should clear up, or that's maybe not in this guidance that businesses say they're reviewing that's going to help?
For businesses specifically, you mean, Savannah?
For anything. Just what do you wonder?
So I just was, there was another feed from the New York Times this morning that said, here are 4 scenarios. You are a fully vaccinated household, you're an unvaccinated household, you're a partially vaccinated household, you have kids who aren't vaccinated. This to the end of the SNL skit with the riddle, where there's so many different, it's almost like a math reading problem that gets so complicated, right? You can think of almost any kind of scenario where it's going to be really difficult to make decisions. I think what would have been helpful, again, is if the CDC had said, these are the public health thresholds that we would like an area to achieve before you implement this. Perhaps it's less than 5 cases, positive cases out of 100,000 people. Maybe it's 70% of your population has received at least one vaccine before doing that. I think that that would have really given businesses and states, frankly, the tools to be able to implement and execute a safe order, for folks, rather than just sort of this blanket recommendation for all vaccinated people.
All right, Dr. Natalie Azar, thank you for helping us through the confusion. We'll see you soon.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.